Hello again, everybody, and welcome to another edition of Doc Talk. This is Doc Talk Live at the Black Hill Stock Show in Rodeo. And I want to kick this off really quick, Doctor, by saying that when I saw the phrase that came across the email, biohacking your joints, I was like, this is going to be one of the coolest podcasts we've ever done.
Catchy, right?
Yes, because stuff's going to get plugged in.
That's right.
And then I realized that that's not what you meant in this one, correct?
It can mean whatever you want it to mean.
Well, I think what it means, I think what you hoped it would mean is that it's taking care of our joints before they start complaining, right? Because most of us ignore them, move badly, we sit too much, and then we act surprised when something hurts a year later. On Doc Talk today, we're going to be talking about that kind of joint biohacking, the ones that it will actually work that we'll get into a little bit. So joining me is Dr. David Woodard, who's an orthopedic surgeon with Monument Health Orthopedic and Specialty Hospital, to separate the real joint longevity from hype and explain, I think, what he wishes people would do long before surgery ever enters the picture. So welcome, Doctor.
It's true. Thanks for having me.
You bet.
It.
Thanks for coming in. I am severely underdressed for this. I didn't realize you were going to come in looking
That's
like
right.
this.
There's a dress code for people who have to stand next to the ring. So
I guess that makes perfect sense. Yeah. Well, let's start big picture. You've been on the podcast before. We've kind of got a bit of an introduction to you. You're a South Dakota kid. You're from Brookings originally.
Correct.
What got you into this field? From when you were a kid looking up at what you were going to do, how did you end up here?
I think if you zoom out, the things that gave me the most fulfillment in my life were being active with people that I enjoyed. And so I think that as I looked at what I wanted to do to participate in the field of medicine, what I'm most fulfilled by is giving people the opportunity to continue to do those things that they enjoy most. And so that's what I really like about orthopedics and specifically the field of sports medicine and cartilage preservation, that I get to give people back whatever it is that they enjoy most about life.
Yeah.
I give them the opportunity to continue to participate in that.
And that's what we're going to actually get into today, really. When you hear the phrase, or when people hear the phrase joint longevity, what does that actually mean to you as a surgeon? Like avoiding surgery, delaying it, what does that mean to you?
In some cases, delaying or avoiding surgery, certainly. I think that within the field of orthopedics, and specifically there's a field called joint preservation. And what that basically means is doing non-operative and operative interventions to keep your joint as long as possible. We know that young people who have arthroplasty or joint replacements have to significantly change their life in the most cases. And so I'm really interested in the field of medicine when it comes, as it pertains to operative and non-operative management of injuries, specifically to the cartilage, or procedures to prevent injuries to the cartilage long term in order to, once again, just maintain whatever it is in your life that brings you the most joy.
Well, and I don't think when you mention that, it kind of leads into this. I don't think a lot of people think about their joints really until they start to hurt, right? What are some of the earliest warning signs that a joint isn't aging well? Even if you don't feel it, can you tell when something just isn't doing what it's supposed to do? It isn't aging like it should?
The primary indicator of a poorly aging joint, as you're alluding to, or cartilage damage in general, is pain. Obviously, other symptoms like swelling or mechanical symptoms like a catching sensation during articulation or movement of that joint is another indication. Some other symptoms that you might feel are instability, but that has mostly to do with joint stability rather than actual cartilage injury. So those are the main things to kind of keep in mind and watch out for when you're talking about cartilage health.
What everyday habits kind of wear down your joints the fastest then? You're seeing all the people that are around here. I mean, you're the rodeos especially, right? That can't be good for a lot of these cowboys.
Yeah, it's really good for business, though.
Yeah,
really good.
I'm sure
so don't
for you,
stop. Please don't
totally
stop
it is.
hopping on these animals.
But aside from sports, what are things that people do that maybe without realizing it that do cause these problems down the road?
Yeah, so I mean, the good news about cartilage preservation is that there's high level of evidence for a few things to preserve your joint. The bad news is it's not a pill or it's not an easy fix. But the good news is it is free and it does require some effort. So when you talk about high level of evidence for cartilage preservation, it basically comes down to two things. One, in order to preserve your weight-bearing joints, it's really important that you maintain a healthy weight. Anytime that you become overweight significantly, or even by 10 to 20% more than ideal body weight, that has an impact on your cartilage. And there's more and more research coming out that describes the pathways that contributes to cartilage health. And the main one is mechanotransduction. So just loading the joint with a weight that it's not specifically designed to be loaded at, actually wears that cartilage down at a higher rate than it's expecting to wear out. So it's kind of a fine line, because on the flip side, the other thing that is high level evidence to preserve your cartilage long term is actually to maintain a level of physical activity. And so it's this fine balance between maintaining a level of physical activity that physiologically loads the joint on a regular basis, but also doing that at a healthy weight to not expose your joints to excess stress. So the thought that this cartilage, we used to think that it's kind of this passive glazing on your joint that slides back and forth and serves almost as a rubber tire, and the less you use it, the longer you're going to keep it. That is a totally old way of thinking about your cartilage, which is actually a bioactive connective tissue that responds to things like stimulation from articulating or being loaded. So it's really important. Those two things have high level of evidence to support the idea that you have to maintain a healthy level of a body mass, and you have to continue to load your joint in a physiologic way. So the good news about that is you don't have to be a marathon runner or a triathlete, a CrossFit athlete, in order to load your joint at the physiologic load. So what I'm talking about is loads that you would normally experience during activities of daily living, such as walking, or even low loading scenarios like riding a bike, elliptical, swimming. Those type of things are really good for your cartilage, actually, long term. Way better than rest even. So we've taken studies of, one of my favorite studies that's kind of come out recently is they've taken MRIs of people's knees right at the time of an ankle fracture on that same leg, and they've observed the thickness of that cartilage. And then they take that same MRI, that same knee, 8 weeks later, that cartilage is thinner. And that cartilage hasn't, and the reason is because it hasn't been exposed to the loading that is necessary to maintain a healthy extracellular matrix, is what we call it. So the other thing is, as we talk about the body mass, it's really important to be aggressive about that. But the good news is that you don't have to lose a lot in order to make a big difference. So 1 kilogram of body weight translates to about 2.5 kilograms of force on your knee. Sometimes we even think about it as even being 5 times the amount of weight that you've exposed yourself to. So no matter how much weight you lose, it's multiplied because the knee is such a small surface area.
And this, I'm assuming this works for knees, hips, shoulders, all of it.
Yeah, so any load-bearing joint. So like, thankfully we don't walk around on our shoulders anymore. So you can actually tolerate cartilage lesions in the shoulder much easier than you can in, say, the knee or the hip or the ankle. But so that's when we talk about cartilage preservation, most of the time we're talking about load-bearing joints.
You're talking about movement and how important that is. I mean, it just seems to be across all areas of health. Movement is important. This may seem weird or a strange question, but are there more right ways to move when you're doing it, aside from just getting up and going for a walk? Is there a pace that's better, or for instance, something like that?
Yeah, so I mean, the studies that we've seen are mostly in vitro, meaning studies in the lab. So like 1 hertz or 1 time per second of a load is like a physiologic load. And so the good news is that you don't have to be squatting 500 pounds in order to stimulate your cartilage. It's actually
thank goodness.
Yeah, good for you and me. It's actually probably better if you don't, because you can overload the joint. And so exposing your joint to normal physiologic load that you would see in like a daily walk or a daily swim, that's the type of load that we're talking about.
Okay. Are there behaviors that show up in patients who keep their joints healthy later in life that you see that you're like, I wish more people knew about this? And like can some people's joints just be good their entire lives?
Certainly a genetic component
Right.
to the longevity. And so that's why it's super important who you marry, not because it affects your joints, but your kids will blame you because you gave them their genes.
Yeah,
So,
okay.
Super important to keep that in your premarital counseling. But the second thing is, besides maintaining a healthy body weight, besides maintaining an active lifestyle, the third thing is just to avoid getting injured. Because let's take the knee, for example. The meniscus is a structure that serves in your knee as an articular shock absorber, basically, is what it comes down to. And the ligaments keep your knee moving in the way that it's supposed to move within a certain parameters of motion. Well, if you damage either one of those things, all of a sudden your cartilage is seeing load that it's not used to seeing. Even if it is healed or repaired, it's still going to have some sort of permanent outcome, the consequence. But especially if it's not fixed, if it's not reconstructed, in the case of like an ACL, then your knee is all of a sudden seeing forces that it never was supposed to be exposed to. And so in addition to staying active and staying light, avoiding injury is really important. So that's why it's a running joke in my OR that whenever I see a terrible injury, at some point in time in the case, I'll mutter something like, well, this is why I watch football and read books for fun, because I don't ever want to end up a patient. And so that's one of the main things, though, that like I encourage people to continue to be active, but be active in a way that you enjoy and is safe, because the worst thing you can do is get hurt.
Absolutely. Well, I mean, it keeps you in business.
It does.
For sure.
I mean, I want everybody else to continue to do those things, of course. But.
Well, let's talk a little bit about this idea of biohacking, okay? Which I think encompasses things like supplements to braces, recovery tools, right? Let's first talk about the right things to do. Are there supplements that exist that can help your cartilage?
Unfortunately, the reality is that there's just no high-level evidence that any supplement you can buy over the counter or even as expensive as you want from any of these ads has any like long-term significant impact on the health of your cartilage. There are some treatments that we can do that probably significantly impact symptoms. For instance, one of the things we offer through Monument is called a platelet-rich plasma injection. So if you're kind of interested, after this podcast, get off and Google PRP. And what it is we concentrate your own blood and we concentrate it down to plasma. We take out all the red blood cells. And what it probably does is it serves as an anti-inflammatory agent. So then we inject it back into whatever joint is hurting you, commonly say the knee.
Right.
And while that doesn't necessarily line your knee with new cartilage, it does significantly improve the inflammation in your knee and the pain and the swelling, which ultimately is the goal, because your cartilage can look whatever it wants as long as you're able to do what you want it to do and you're not in a significant amount of pain. That's a win.
Well, how many times do you have to do this then?
I mean, that's a good question, because like some of the studies that have been evaluating the effectiveness of PRP are like once a week for 3 weeks in a row. However, I have had patients experience benefit after a single injection. And to be honest, most of the time, that's what I recommend.
Right.
The common question that they usually have is, well, how many of these can I get a year? The truth is we don't know what's safe and what's not safe. So usually I recommend either 3 or 4 a year at the most until we should be talking about something else. And it's been highly effective in certain patients. I think the meta-analyses are starting to show that it's at least as effective as any other injection, and a lot of them are showing that it's more effective than, say, your hyaluronic acid or your HA. Definitely better for your joints long-term than steroids, which is a decent Band-Aid if all you're trying to do is kind of punt your arthroplasty down the road. But definitely better for you long-term than steroid injections.
So you were talking about how exercise is very good for your joints. You know, you're not going to wear them out. I mean, well, maybe, but I mean, to keep them healthy, exercise. So if people go out feeling discomfort and put a brace on it, does that diminish the effect of the exercise then in wearing a brace now?
No, and to be honest, braces probably, unless you're actually getting them from an orthopedic surgeon or somebody who is trained in the field of musculoskeletal system, it's mostly a psychological benefit.
Really?
And is proprioceptive. Yeah. So, I mean, they probably aren't doing a whole lot. There are some exceptions. For instance, like if you have a medial compartment osteoarthritis, you can buy a brace that's specifically designed to load your lateral compartment, and so that you're wearing more on that lateral side than you are on the medial side. So in that sense, it probably is offloading the joint that is causing you problems.
Right.
But that's not something the average person can just kind of pick off the shelf. So braces for me are a short-term solution because most of the time they're kind of one size fits nobody, and nobody can really tolerate them for much longer than a few weeks at a time.
Right.
In my experience. So
Okay. Well, how do you help? Because obviously this can be painful, right? Any sort of cartilage damage, ligament damage, anything like that. How do you help patients understand the difference between normal soreness, the warning pain, or when it's like, look, you have to go in now and get this taken care of?
Yeah, I think that's a good question because I have patients who come in at the first sign of injury or the first sign of pain, and that's probably an overreaction. Unless it's a significant traumatic event.
Okay.
So like if you fall and you have significant pain and swelling and disability, you should be evaluated, right? But if it's the type of thing where it's kind of slow onset and burn kind of like on a back burner for a while, after a few weeks to 4 weeks or a month, if you're still consistently having pain after doing all the normal things like rest, ice compression, elevation, anti-inflammatories, then it's time to be seen because it could be a harbinger of bad things to come. And there are specific things that with early intervention could save you
long term,
Right.
obviously.
You could significantly impact the long-term course of a joint if you intervene early in certain scenarios.
Well, we've talked a lot about damage, accidents, things like that that can happen. Of course, everybody listening, everybody watching, we're all aging and we can't stop it, right? This is just a thing that's going to happen to all of us. So when it gets to joint degeneration, I mean, it's inevitable. Do some people age out, pass away gracefully in their sleep at 107, never have that joint pain? Is that something that happens, or will everybody end up with it because of just getting older?
Certainly, genetics can
play a part. So marry the right person,
right,
that whole
exactly.
thing, right?
So your kids won't blame you for forever. But I mean, I think that when you look at people who are in their 70s, 80s, 90s, and haven't had a single arthroplasty, those people obviously have had good genes, but they stayed active. They didn't have major injuries, and they aren't significantly overweight. And so that's really the formula when it comes down to giving yourself the best shot at long-term cartilage health.
Okay, because it is mostly inevitable. I mean, those are going to happen. But again, stay active. It always seems to be kind of the overarching theme in a lot of this stuff.
And I mean, the good news is you don't have to be a triathlete, right? So like just doing whatever it is you want to do, as long as you're getting your heart rate up and you're moving, is definitely better than doing nothing.
Absolutely.
And so that's where I would usually recommend people start.
Are there common patterns you see in patients who end up needing joint surgery earlier than expected?
Yeah, and it's the exact opposite of everything that I've previously said. It's the type of person with terrible genetics, the type of person who is really heavy, the type of person who has a traumatic injury, or the type of person who isn't active. And so those are the type of people who usually end up getting arthroplasty at an earlier than expected age because they've unfortunately done the exact opposite of all of the things that we have high level of evidence to support preserving your joints long health.
Now, and one thing I always like to ask you guys, because how long have you been doing this now, Doctor?
It depends if you include training or not, but it's about a year.
I mean, training, the whole thing, going back to when you were. How long has it been?
It's like 10 years.
10 years,
of education and training.
I'm assuming you've seen changes in that 10 years, advancements, correct? Do you see what's on the horizon right now for this? Are there exciting things that are coming out that you, as a surgeon, look for or think, hey, this is going to be a game changer?
Yeah, so I mean, I think that like you start looking back, and so the joints that I operate on are the hip and the knee and the shoulder primarily.
Okay.
Hip arthroscopy wasn't even a thing until the 90s. So like this something that I do wasn't even a surgery that was developed 30 years ago. And so when you think about that, like medicine is changing fast.
Yes.
And so when you think about the horizon, and as far as cartilage health goes, the most exciting things, like long term, way off, are things like gene editing. Like, are we going to be able to get to a point in time in which we can identify a 50-year-old who's going to get arthritis, and we can intervene and somehow edit that gene at either in their life or for their offspring and prevent that from happening in the first place?
Yeah.
That's way off there. I think there's some interesting studies coming out of Stanford on a gene called the gene, and it's like a big fancy name, but basically what they do is they take these mice and they knock out this gene, and then they don't develop any arthritis, mice who otherwise would have. And so that's kind of far on the horizon, though. That's not even close to clinical trials. But at some point in time, ethics aside, we're going to get to a point in time in which we can start changing the genes of humans. And so, but I wouldn't hold your breath. That's not coming anytime soon.
So my knee's going to hurt no matter what?
Yeah, I wouldn't hold your breath for that.
Now, are most of the surgeries that you perform, are they laparoscopic type surgeries? Is that how most of them go?
Yeah, so in the joint we call it arthroscopic, but it's the same kind of concept where we stick a camera in, and many of them are. For instance, like you can do a meniscus repair through a camera, an ACL reconstruction assisted with it. Some of the procedures, like a hip arthroscopy, when you talk about hip preservation, we talk about shaving down bony deformities on the femur that would otherwise cause cartilage damage. We can repair the labrum in the hip arthroscopically. When it comes to shoulder, like if you have a dislocation of your shoulder, we're pretty aggressive at intervening in young active patients to repair the labrum, which is the bumper in the shoulder. So most of the things that we can do within the field of sports medicine are arthroscopic, but occasionally, like a procedure that I have done before, like if a person dislocates 50 times, they shave off enough bone on their shoulder socket, you actually have to replace that bone with a cadaver bone with cartilage on it. And that's much easier done open. You can do it arthroscopically, but in my hands, it's just easier to put it where it belongs and to put some screws in it to fix it there.
Well, I mean, it sounds like this is already pretty futuristic stuff, really, when it comes to what you do.
It's really fun to be on kind of the cutting edge, no pun intended, of sports medicine and being a cartilage surgeon, because you can intervene in young people's lives on a regular basis and significantly change the course of really their life.
Right.
Like if you have a big cartilage injury as a 15-year-old, like the one I operated on 2 weeks ago, who had a patella dislocation and sheared off a huge piece of his cartilage, and you can just put it back and repair it, that significantly changes his whole life. Not just his young active years, but the whole course of his life is altered. So that's what's really exciting about being a cartilage surgeon.
Well, when you walk around the stock show and you see all kinds of people from all different walks of life, really, are there things you would like to just tap them on the shoulder and say, look, here's one thing I want you to change right now to make sure that your shoulder, your hip, your knee is going to be okay? Are there things that you can tell people now that are listening or watching, just 2 or 3 changes they can make? I mean, aside from, like the obviously the exercise, we know that that's a very important thing. But are there other realistic changes they could start this week to make sure that they'll have a real difference long term?
Yeah, I think one of the things as a cartilage surgeon, you have to be pretty aggressive at managing your fitness. Small changes don't really compile when it comes to bad habits. You have to get pretty drastic. Like if you need to lose a significant amount of weight, you have to get drastic about that. And you can't do it by yourself. And you have to ask for help from your significant other as well as your physician. And so one of my pieces of advice is obviously try not to get hurt and maintain a physical active lifestyle. And when it comes to significantly altering your level of physical fitness, if you need to make a big change, you got to get help. You can't do it by yourself. Yeah. So I think those are the main things. And come and see us if you get hurt,
course.
Because if you ignore an injury for a long period of time, you can get to the point in which it's irreparable. Like meniscal injuries, bucket handle meniscus injuries. I had to cut out this whole kid's meniscus the other day because it had been trapped in his knee for 2.5 years. It's just irreparable at that point in time. So
what happens then for what's his life like then without that?
So a person can perform meniscus transplant actually. So
okay.
could be a potential option for somebody like that in the future, and that's again, one of the fun things about being on the kind of the cutting edge of sports medicine is that transplant options there's a wide variety of transplant options, and you're not talking about arthroplasty at young age for these people.
Right.
If you're able to intervene with a transplant of a meniscus or a cartilage, and you can significantly alter the long-term course of this person's life.
Well, it does really seem, Doctor, that you are passionate about this, and you really enjoy making sure that people can get out and live as pain-free as they can for as long as they can, right? So I really want to thank you for coming down and doing this live here at the Stock Show. Dr. David Woodard, Orthopedic Surgeon with Monument Health, the Orthopedic and Specialty Hospital. Thanks for coming down and doing this again, Doctor. I really appreciate it, and anytime you want to come back on, let's do it again, okay?
Appreciate you having me. Thank
you bet. Thank you, Doctor.
Yeah, take care.
Thank you, guys.